Welcome to Mission Across Borders. I am Savitran, Chief of Podcast for Council of English Division Students of Poland. And today we're going to speak about the hidden mental health struggles of medical students. And with us, we have a very special guest, Dr. Sarah. I would please request you to introduce yourself.
I am Dr. Sandra Lewis Fresho. I'm an MBBS graduate from Gulf Medical University. I'm currently into volunteering and community service in Bangalore. I joined in as a medical outreach volunteer at Blessed Clare Special Needs School for kids, and I'm monitoring health and wellness of kids with disability.
Wow, fantastic.
Thank you for
Great.
having me on the podcast.
Thank you. Thank you for taking your time out and speaking on this very essential, crucial topic of today. It's we can say that there's a burning problem among students, especially medical students. And so to begin with, I would like to ask, and even for giving our viewers and listeners a background, what inspired you to pursue medicine, and how has your journey as a medical student been?
So I moved from India to UAE for my medical studies. I've always wanted to be a doctor. It's always been my plan.
Okay.
I never had a plan B. And my mom is a doctor, so she's my role model. And when I got this opportunity to study in UAE, I had to put on a brave face and just move forward with it. So the journey has been of like mixed emotions altogether. I was really happy and excited. At the same time, I was really scared because I come from a very protective environment. I have very supportive family. So having them around me was really scary to me. But like I said, I had to put on a brave face and move forward in life. So my strategy was to keep my introvert side away and be a little bit more extrovert, fit in, talk to people. And GMU especially like has I had classmates of different nationalities and ethnicities, different cultures. So for me, I was really proud to have friends of different communities like that. So I
Right.
went, spoke to them, and I joined basketball team. I joined the dance team, which was the White Coat Crew. We got
Wow.
into the
Wow.
international inter college fest competitions. So that was a strategy altogether to like balance. So
Wow.
together
Wonderful.
the experience was really nice. And when it comes to academics, also I was really scared because medical school environment itself is really. I had a feeling that it's going to be very scary. But altogether, the professors also were really nice. I made very good friends, especially since my family was not around, my friends became my instant family. So I have a special place in my heart for my friends from UAE.
Right, all right. And how about the professors and the initial phase of just settling down and pursuing with the whole course? Did you have your own inhibitions of what were the struggles, like what's coming up? Am I ready for it? Like such doubts.
Like I said, I had like a mixed emotions altogether. So I was happy and excited at the same time, very scared because I was like gonna be all by myself in the
Yes.
hostel. I was in the hostel, so I it's entirely different when it comes to like living separately. That responsibility is very high. Here I'm
Yeah.
with the campus in the hostel. I had friends in the hostel. All that was kind of balanced altogether, but I was really scared because I didn't know uh, anyone in UAE. I didn't
Right.
have friends prior to that in UAE. I was scared whether the professors would be strict. I
Right.
had the idea that medical school is very scary.
Right. And when exactly in this process that there was a time when you felt, okay, it's not as bad as I thought, or it's okay, this place is wonderful. Like, what was the feeling, and when was that? Like after 3 months, 6 months, 1 year?
Actually, I could say like 1.5, 2 months easily because just needed that time to get adjusted.
Great. Okay.
Like I said, it would have been very difficult if I would have been an introvert. And if I would have stepped back, it would have been more difficult. It would have taken a longer period. Like
Yes.
as I stepped up, I was a little more extrovert. I wanted to like, get into basketball, dance. I want to academically like take
So
part.
you're mentally prepared to go all out in every aspect, academically and extracurricular,
Yes,
and in terms of making friends, in terms of setting yourself up there.
yeah,
You are mentally prepared and ready for what's coming up. You're like,
exactly.
yeah, okay, perfect. That's wonderful. So along your journey, you must have had a lot of mental health challenges that you might have personally faced, or struggles that you see in your peers deal with. How do you think medical students can cope with these challenges?
So for me personally, like I said, I had to move from one country to another, and coming from a very protected, supportive background, it was a challenge for me altogether because I found myself being like extra sensitive. If someone was slightly
Absolutely.
mean to me, it would affect my entire day, and it would
Right,
go to a point where I saw myself constantly apologizing, overly explaining, and it was efforts only from my side on it
right,
to sort things out. So that was a major challenge for me. I was extra sensitive. I used to get worried all the time trying to sort things out, and that kind of like affected me a lot. I used to think about it, cry about it, be worried, but it took me almost like a couple of months to realize that it's okay if people don't like me, and that's fine. I don't wake up every day to like impress
mm,
them. So that was
yeah,
one challenge that I've had. But over time, I realized it's not important. I shouldn't be wasting my time. And apart from that, when it comes to other friends and their challenges, again, when it comes to unhealthy competitions, being around toxic environment, all that affected, couple of students. And that was like a challenge for a lot of people.
okay, okay. And when you speak about toxic friendship or the competition, unhealthy competition, what exactly do you mean? Could you explain how, not exact, not what, how was it like? Because competitions and criticisms keep coming from our peers within a batch. There's always a competition with that runs, and in general in life also, we do see people around us, next to us, or who are following the similar path or the same path. We do compete with them in a nice way. We take a lot of inspiration from them. Sometimes we are motivated by them. Sometimes we are pushed. Like, we go the extra mile. Sometimes take the extra care in our work in dealing with ourselves when we see competitions around us. So that's a way how it should be taken in a very positive. It should be a driving force. But when you speak about toxic friendship or about the kind of competition within the university, did you feel like it was positive, or how exactly was it? How did it affect or impact you or people around you?
So, like, I think this unhealthy competition has been normalized in professional universities. It just becomes a part of life. No one talks about it. That's the
Right. Yeah.
but has it affected me? The thing is, my goal has always been like I set a target for my score. Like I study, I know my capacity, and I set an aim to it. And if I don't achieve that, I might be upset. But I've never compared that to someone else because I feel it's not fair on me. But when it comes to others, I definitely know people where they look into other people's scores as well, and then they try to like balance out accordingly.
Right.
For them it might be a healthy competition, and if it's not
Mhm.
affecting them in any ways, then it's absolutely fine. We can term that as healthy competition.
Right. I feel like sometimes on that note, few people when they compare, they're not comparing, they're ranking. They are ranking themselves in between like five other people, and seeing that okay, I am in the bottom of this rank, I'm at the top of the rank, and getting the self gratification and the satisfaction from the ranking, which might be okay for a few instances, but not always, because sometimes you do have a bad day and you do have a exam or that one test where you don't perform well, and on that time you crash. You sometimes it really affects them so much that they actually crash, and probably after reaching that point is when they realize that okay, this has been affecting me all through the journey, and all this while I have been ignoring this toxic trait of mine, or the wrong way or perspective in which I'm looking into things. So I feel like people don't realize it to a certain extent, and it's very essential that okay, it's good that we are speaking about it, and thank you for mentioning this. So really, like it's a quality that I think people should like shift from. And as you were mentioning that you used to consider yourself as a competition, I think that is a very good way to look into it. And I even personally I have always been looking into myself, I think from my high school, because I was not a very good student always. I had to step up when once I had a clear vision of okay, where I want to reach and what is my goal. So I think in that way, setting a goal also helped me a lot, and also having a clarity on okay, medicine requires a minimum of this much percentage. Okay, this is my scores as of now, and I need to reach there within the next 2 3 years because this is my high school already. So I need to really step up to a competition, and this is where I'm standing. So it was always a personal journey. It was always a very personalized way of looking into how to improve, where to improve, and how to get there. Like for me, it was always my friends around me discouraging me or trying to put me down in terms of, really, you think you can become a doctor, you think medicine is for you, because of maybe we have a vision with us, we have a goal for us set, and we are working towards it. And how hard we are working is something which people don't really get to see, because that happens in the background. So when they see our current self, when they see us today, and when we say our goal, it's kind of too big for them to think that, okay, you're manifesting something very huge. This is not going to happen. That's the instant like disbelief that they throw on us. But I feel like when you are confident and when you are ready to surrender onto the hard work and the discipline which goes in to reach where you have to reach, once you are fixed and you're ready to give all in for reaching that place and to reach what you have thought for yourself, and what you believe that you can do, and then I think these things should be taken lightly. I feel like mental health also gets affected a lot when things like these, comments like these come across a
Exactly.
person. People around you, when they show disbelief, it really puts you down. And I'm not saying that sometimes it's also a challenge. It can be taken into a positive way, and it's a challenge. It's something to show and prove yourself as to. But you can't always expect positive and encouraging words around you and from your environment. So yes, so coming back to the kind of toxic competition and friendship which you're mentioning about, right? If you can continue further on.
So I think toxicity, some amount of toxicity is experienced by every individual in different settings. It can be school, university, workspace, even at home, unfortunately. So from my little experience and what I have witnessed among others, I've learned two things. So one is, no one can verbally advise us on how to deal with toxicity. You have to experience it, find a solution for it. And
All
most
right,
of the time the solution would be to, move out of that negative environment very
right,
peacefully without any drama. And the second is to identify that it is a toxic friendship. Because
right.
every friendship cannot be termed as toxic. Because I have friends, I have very close friends, and we've had misunderstanding. But how is it different from toxicity? It's that when we have some sort of a misunderstanding, we sit down and talk about it, and
Right,
we have to provide that space for the other person to explain and understand from their point of view as well.
right.
But toxicity is when, someone is good to you and extremely mean to you at the same time. So you don't know where to group this person. Is she a good friend, bad friend? You can't
Right.
at all decide on where this person stands. And so at one point, you will think that you're the problem,
Hmm.
and you
All
will
right.
constantly apologize, overly explain, and you're taking all the effort, but the other person is not taking any effort at all. So that kind of an environment creates a negativity around you. It will affect you to a point where you're not studying, you're constantly crying, thinking about it, wasting your time. Instead, just move away from that environment very quietly without any drama, and that'll be the safest to deal with these kind of toxicity.
All right, all right. So you're saying that the first step is to recognize that this is a toxic environment and toxic friendship, or the person is being toxic. So you say that instead of correcting the person, or instead of bringing this up, or having a more discussion, or wasting any more time onto why is the person getting toxic or being toxic, it is rather smart to move out of the situation. That sounds like a great advice. I think it works for many. All right. So looking ahead, what are your future plans? Also, what advice could you give to medical students in third and fourth years about preparing for the future? And how can this help with managing their own mental health struggle?
So personally, for me, I've been doing a lot of volunteering programs and med camps for both cooperative offices in UAE to manage their health and look
Wow.
into preventive medicine altogether. And when it comes to India, we've done med camps for local
All right.
communities in the panchayat sector. So and currently now I'm part of special needs
Fantastic.
kids. So I really love volunteering and would love to
Yes.
continue with that at least for a
That's a
couple
very
more,
noble thought, actually. Being
months
in
to a
this
year.
field, I think having such a viewpoint is very nice.
It's really rewarding. It makes me feel very happy. So I thought at one point I'll stop and then move ahead with like being a general practitioner and just like that. But this keeps me so happy, and this is something that I've always wanted to do. Like when we were kids, like we used to say things like, oh, I want to become a doctor to help people out. So getting this opportunity to do something for the community is, something very rewarding. Feel very happy by the
Yes,
end
and
of the
I
day.
think it's also very
So I'm going to
selfless.
continue.
It's very nice. It's very good to hear, and I think many should actually take inspiration from this and contribute to the community. And me, myself, I also have been doing community engagement program, trying to take part in it in any way possible. And also during Ramadan, going to the liver camp, or whether it's donating food pulses to the Red Crescent and Emirates group. So we do a lot of campaigns. I do take part in a few of them. So far, I've done such works, and I'm really looking forward to contribute through such organization to underprivileged people in such areas, and get inspired from when I see people saying that they have done some work of in this section, and that's really fantastic.
That's really nice. Like you should be able to like manage both volunteering as well as working. And I think it's possible when we continue as well, if we are taking residency or becoming a general practitioner. Exactly. So, and at the same time, I'm looking into licensing
All
exams
right,
as well in India, UAE, and I'm looking into residency programs as well. So I've kept my
all right,
options open. If I have to give any advice to my juniors, the ones that are coming up into this field, I would always say, see, once we start off with first and second year, we'll have like a vague idea, multiple options of what we want to do next. There's some people who just want to become general practitioners and move on. Some people want to do volunteering. Others are looking into residency program. They want to volunteer, get into research. So they have a vague idea about
all
everything
right,
once they get into med school. So I would say, like, when it comes to third year or second year itself, you should try to get in touch
mm-hmm.
with seniors who are in particular paths. So if you want to try your UK PLAB exam, get in touch with the senior
Right,
who's in that path so that you have an idea of, you'll get updated
yes,
information. You can find out what exactly is foundation year one, year two, what exam should I give, when should I do it. There are a couple of exams that can be done
yes, yes,
between universities, and others can be done after internship. And there's few exams where you don't
right,
have to do internship. Internship is always a plus point, because for me especially, I didn't know which particular department would be interesting unless I got into
right,
internship. So third and fourth, other advice would be, when you get into your clinical rotation, look into every
right.
factors and see what you're able to relate or you want to
It's kind
get
of
into
narrowing
that
down your options into
clinical rotation.
something which is practically possible for you. You are interested in.
Exactly. For me, third, fourth year, when I got into each rotation, I was looking at the advantages and disadvantages for me personally. If I take up this is what challenges that I'm going to face. This is what I'm going to like about this particular department. So for each department, I kept narrowing it down. And when I reached the fifth year, I've always wanted OBG gynecology. I really liked that particular department. But when I finished the rotation, I felt that's not
Right,
the
that
one for
happens
me.
usually. Yes.
And and only during internship, I was like, I got hands-on experience when it came to pediatrics, especially, and the doctors over there became my
Right,
role models. So I had like a liking towards pediatrics, and I was able to figure that out only by the end
right,
of internship. Third couldn't. So I would say always like look out for what your interest is instead of just like being present in the
right. And
clinical
okay, so you did
rotations.
mention about students in the first, second year, or how they should pick up and how they should figure out. And you're mentioning about the students in the third and fourth year that they should narrow down their options and look into their future options, like possible options, possibilities, and keep them as a option A, option B, or get a clarity on if
Yes,
they have a liking towards something. Make sure that they're 100% sure about that. That's great. But
yes.
how about managing mental health struggles? Like, do you think that there's anything that students in these years can do or should do, which you think, and that can actually help them uh, like, avoid some avoidable mental health struggles, some challenges?
There's a lot of competition throughout, especially in professional universities, especially in medical school. So all I would say is that like concentrate on your path throughout. So if you have a path designed for you, just work on that particular path, and no one else can get into your path and disturb you. throughout. So I would say, like, concentrate on yourself, do something that keeps you happy. If it's like research work, get into research work, be a part of the group, help out, get into extracurricular activities. You want to do electives abroad, go ahead, experience that. Concentrate on yourself, be a little selfish when it comes to that. And always remember that your path is designed only for you and no one else can get into it. So don't see others as a competition. Their path is entirely different, your path is entirely different. Don't get stuck in that particular race.
Right. All
I
right.
would say.
That I think that's a very great, wise words. And we have covered a lot from academic struggles and peer pressure to recognizing mental health symptoms and offering how can one and you have offered some great advice and tips which one can follow and should be following or consider when they are in a situation dealing with mental health struggles. So that's fantastic. And thank you so much for your time and speaking about this topic. I think mental health issue is one such problem that has to be brought up and has to be given its limelight so that people can recognize it, can understand what exactly does one go through when they are having mental health challenges. So thank you for your contribution into this topic.
Thank you for this opportunity. Very happy to be a part of your podcast. You're doing
Thank you.
great, spreading awareness on student and mental health. And I'm very proud of juniors like you. Continue, keep going forward. You're going to
Thank you
reach
so
great
much.
heights.
And to our listeners, stay tuned till the next episode, and we'll get back with some burning problems like these and create awareness. Thank you.